Hello, and welcome to the Thyroid Pharmacist Healing Conversations podcast. Today, we're going to be talking about cognitive decline and why everybody really needs to pay attention to this. In the studio with us, I have a very special guest, James Maskell. Welcome, James.
Great to be here with you in person.
I know, it's so amazing to get to spend time with you. We've been collaborators for over a decade now, I think, and you've always been up to some really, really cool things. So I'm excited to have you here, and you're making really big waves in the world of cognitive decline.
Yeah, I'm excited to be here. I haven't always thought that cognitive decline would be my thing. And in the last 10 years, I've really been looking to grow the community of doctors and practitioners that were delivering care in a way that could reverse chronic illness. And so that's been my work for 20 years in lots of different ways. And that's some of the ways that we got to play together over the years. But this really came home to me about a year and a bit ago, December 2023. My father lives on the other side of the world. So I live in California and he lives in Cape Town. And, I can tell he's in his mid-80s, and I can sort of tell how he's doing based on his WhatsApp communication, right? So we have, in times where he's doing well, we communicate every day. And then I started to know just a little bit of a drop-off. And then in December, I got a call from a friend saying, your father's collapsed. He's in my house. We were out for lunch. He couldn't remember the PIN number to his, to get out money. And then he was just really disorientated. I've taken him home and he's asleep in bed and has been for a couple of days. So you do what the only child obviously does and get a flight as soon as you can. And myself and his brother, he has a twin brother who lives in England. We both flew out there to go and check in on him and see what was going on. The interesting thing is, because I've spent the last 20 years in functional medicine, have a lot of great colleagues and friends. I have my doctor, who's Dr. Christine Burke, and then my kid's pediatrician, Dr. Nicole Shorrock. And I was just, telling them about what was happening. And both of them said, if you have a cognitive decline that's that rapid, you should look for an infection. Because there's lots of reasons why cognitive decline can happen, but if it's that rapid, look for an infection. So I go armed with that information. And when I arrive, I see someone who is like almost indistinguishable from death. I mean, lying there, eyes closed, breathing slowly, not waking up, not talking, not participating in any way. And all the people around me who are extremely well-meaning friends are like, okay, well, this is what death is. Start preparing for death. And I'm there. So so that was the arrival. And then as soon as I arrive, I see, okay, well, is there an infection? And there's no obvious signs. I mean, I'm not a physician, but like I'm speaking to their doctor. But what they had said is, look, if there's no infection, then you need to go and check out the house for mold. So I go to his apartment, I get in his little car and I drive to his apartment. And you probably have this radar as well. But as soon as you walk in, I was like, I know what's happening here. And it smelled like mold. I could see the black mold. And in that moment, I start to go back in my mind to all the times in the last few months where he's telling me, it's raining. It was a really wet spring in Cape Town. It's raining. I don't want to go outside. I'm tired. I think I'm just going to stay in bed today. So I'm just remembering all those kind of things. And realizing what had just happened, ultimately an accumulation of mold in the house, being in the moldy environment, not getting out of bed, losing muscle mass, and then coming to that moment. So I was informed and empowered by that information. But also I was like living in a very sad moment to not know, not what was about to happen.
Wow. That's such a challenging situation to go and see your father, the man that raised you, in such a fragile state. And it can feel quite devastating. And the doctors at the time, the local doctors and everybody there was just sort of like, this is it. This is prepare for it. This is just nothing we can do about it. Is that kind of the case?
That's right. Yeah. And also doctors sort of trained in this area, palliative care and otherwise. So, but I didn't really know what I was getting into, as well, but I had this information that I was brought to. So, it was clear that one, he couldn't stay in his apartment anymore. And two, that he couldn't stay where he was because it was just like a friend's bed, essentially. So I have very close friends there because I grew up there. In fact, the woman who married my wife and I has a beautiful house about 40 minutes away, right by the ocean. And they said, well, why don't you just come and you can spend your last time with your dad? And this will be sort of like palliative care in community, end of life care. We'll all be together and you can. I really wanted someone that I could like talk through the feelings that I was having about, exactly what you said there. So we go out, we take an ambulance because I can't lift him out of the bed. So we're in an ambulance and we take an ambulance out to this little town called Fishhook, which is about 40 minutes outside of town, right on the ocean. And we have someone who comes to sort of help out in sort of a nursing capacity with some of the more intimate support that
Sure.
people need. And I'm staying in the same room. So I'm like, we're in single beds sort of next to each other and I'm taking care of him. And, the next day, he's sort of like a little bit more alert and we're having, a little conversation and I'm helping him get up and putting him into the wheelchair and we're going outside and looking at the beautiful view outside, sitting outside. And a week goes by and then the palliative care doctor comes back and sees he's had a bowel movement. He's able to like hold a little bit of a conversation and they're like, he doesn't actually have a terminal illness.
Wow.
And I obviously knew that because I knew that it was mold poisoning. I mean, it was obvious to the doctors in America who had never seen him and never met him, but they just know like if it falls off that quickly, it's always an infection. And if it's not an infection, it's mold. Well, here it was. And it was obvious to me. And I'd been kind of telling everyone, hey, I think it's this, but those guys don't really know me like you know me, right? So they're just sort of like, well, we'll trust the doctors on this one. So then it was obvious what was happening. So at that moment, I'm having to now rethink the plan because this man is not going to die, anytime soon. Definitely needs full-time care because the biggest thing is the muscle loss. So he's not able to get around and sort of have the strength to stand up or move around or anything like that. But at least now we know what's happening. And over the next couple of weeks, I stay for another 2 weeks. I stay for a month in all. I miss Christmas with my family. I'm literally on Christmas Day, 10 hours ahead, FaceTiming with my eldest daughter, who's holding the FaceTime to watch my youngest daughter like open her presents and feeling very far away, but also feeling connected to the community that I have there. I have a lot of friends from growing up there. And ultimately at that point, I'm coming to the realization that, there's going to be hopefully some sort of recovery by taking the person out of the unhealthy environment and sort of planning what that would be. So that was in the space of about 2 weeks. And it was just interesting to then see the other people around realize what was happening too. And I guess I just thought to myself, how much power if you can make predictions without ever having seen someone about what's happening and what's about to happen, you have a better model for understanding this condition.
Amazing. So just getting him out of the moldy environment was so incredibly helpful for bringing back some of his cognition back on board. Were there other things that you did to support him through that process?
Well, look, the very basic things, are like food and getting around and exercise. So we set up, we had a few more different appointments, but before I left, we found a frail care, situation where he could have full-time care, which is what he needed. He couldn't obviously cook for himself or take care of himself or, even use the bathroom and that kind of thing. So we had a care situation. And I was just sort of like, let's just do this for a bit. After a while, we added in, things like binders and, went a little bit deeper into, providing some of the support. But the good news was actually he just started getting better, and by April, we were back to having good conversations on WhatsApp. And by, July, he was able to read and now reading 3 or 4 books a week. He'd always loved reading. And they had, different books there. And ultimately we were starting to have different conversations about, what the future held or otherwise. But in the direct aftermath of being there and seeing that, I realized that this was sort of like a new part of the mission for me. I'd been excited. In 2017, there was a big conference in where was it, in Los Angeles, and it was all focused. It was the IFM annual conference. It was all focused on this new model of cognitive decline. And Dale Bredesen was there. He had written the book The End of Alzheimer's, and he was starting to train clinicians in this multimodal approach for cognitive decline. And I'd been excited about it then, without necessarily like the direct personal experience. I'd experienced my grandmother when I was very young in that state, and ultimately this was sort of a realization that I needed to start the process of how could I get it so that that doctor in South Africa would have access to that information, so that this elevated standard of care could be executed. And that's the sort of mission that I've been on since then, and where I think we're sort of getting to the point of having a solution for.
Yeah, it's interesting to be on the other side of it because you can learn about all these amazing protocols. But when you witness somebody completely turning around and that person happens to be a loved one of yours, it's just like, okay, you need to tell the whole world about this. Now, how is your dad doing today?
My dad is doing okay. I say he, has much improved. So, he is able, we still speak on the phone, really regularly. I would say that there are some like psychosocial elements to like his desire to get better, and I think so much of the energy that is required to heal, requires this internal locus of control, right? So the doctors can't do anything about it. It's up to me to do it. So in some ways, he lives a healthy life. I know, I wish that things might be different living on the other side of the world. I wish that I could be with him more. I've been back, to Cape Town since. I don't think he's in a position where he could like do a 24-hour flight across the world. And, I think that there's that, but also in Cape Town, he has he's the only person in the place that he lives that has 15 to 20 people a month come and visit him. And that's because of the generosity and community building that he did through his life and the friendships that he's developed. So I would say he's so much better than then. I had a dream for what I thought would be possible. And some of that has been possible, and some of that is just impossible due to the nature of, what it's like to get things done in South Africa, living on the other side of the world or otherwise. But it has inspired in me a desire to, solve this problem at a much bigger level. And that's what I've been, focused on for the last year. I went back to Dr. Burke, who was the one who sort of helped me with this. And she's one of the top doctors in reversing cognitive decline. Right now, there's a trial going on. You can go to Dementia Reversal Trial, but there's 6 sites around the country where the top clinicians who have trained in this since that 2017 conference have got good at it. There was an initial trial that came out that showed for the first time a reversal of cognitive decline, and that came out in Alzheimer's Journal 2022. And now this is a placebo-controlled trial, which is the next sort of stage of evidence to show that it is possible consistently. And ultimately, I mean, I can't speak to the outcomes that are coming in the trial now, but certainly there's plenty of evidence that that this is very possible under the care of a doctor who knows how to implement and execute the protocol.
Oh, yeah. I mean, that's incredible. I know it does take a long time to recover from like mold toxicity and a lot of these changes. We're not going to change things overnight, but if we keep putting the right tools in front of the person, we can absolutely reverse and definitely slow down that process.
Mm.
And I think you're the perfect person to spread the word about this. I know we used to call you the Ryan Seacrest of functional medicine. You've been at this community building
Yeah.
for quite some time at this point. You've built the Functional Forum, Evolution of Medicine, Heal Community. So I'm really, really excited that you're now a powerful voice for advocating for older adults and people who may not be able to advocate for themselves. Imagine if it was somebody who didn't have all the connections that you had,
Yeah.
all of the years spent with talking to brilliant doctors, being on the cutting edge. What would have happened to their family members, right? And there's so many people that need this information.
Well, I'm glad you said that, but I also want to just point out that if you came on this episode thinking that this is something for old people and it doesn't have anything to do with me, the new data is showing that not only are the elder population more likely to get cognitive decline, but it's happening younger and younger. So there was just a study that came out and that showed that even in people in their 30s, 40s, and 50s, the level of cognitive decline is increasing rapidly in those segments. So that means that this is not more people living longer and therefore those numbers go up. There are definitely changes in our environment that are driving cognitive decline. And if you look back, I mean, last year after I came back from my dad, I was driving on my ride along mower listening to a book called The Indoctrinated Brain. And it was basically saying like all the things that happened during COVID, whether it be loneliness, fear, isolation, the effect of the spike protein itself, all of those things can lead to more cognitive decline. And all of those things together, plus all of the other potential causes that you know a lot about, the toxins in the environment, the gut, the metabolic inflammation, the mitochondria, all
Thyroid.
thyroid,
Yeah,
exactly.
hypothyroidism, a clear cause of cognitive decline that's not looked into.
So then the whole point is, how can you set up a system where any clinician can identify what the cause is or what the causes are in this person and then deal with them appropriately? Like, certainly the obvious thing with my dad was the mold, but I know that there's metabolic inflammation going on there because I know how he eats or how he has eaten, right, until this point. And so ultimately, that's the game. And ultimately, that game is really the transformation of medicine that I've envisioned and you've envisioned for a long time. Is, once you see the elegance of the outcomes of getting to the root cause, empowering the patient, getting them to participate, it's hard to look away. It's hard to think that I want this for everyone. And so this is where we're focused now, is delivering on that end.
Yeah, I love that. I know a lot of the times that I put out a lot of information on how to take charge of your health when you have Hashimoto's. And a lot of the things that Dale Bredesen advocates for, I'm advocating the same for reversing Hashimoto's, right?
Yeah.
And so nutrient deficiencies, looking at chronic infections, looking at various toxicities. And one of the biggest challenges for people is there are absolutely those like type A people that will take a book and they'll be able to implement everything themselves. But there's also that person, and many of us that do need a lot more support throughout that process. They do need those clinicians. They do need functional medicine. And the challenging thing, as you and I know, is that functional medicine docs who are trained like to the degree where they can actually make an impact, there aren't that many of them. And it takes them a long time to work with somebody. And oftentimes they're not accessible because their services might be, you know, out of state or whatnot. The person might not be able to get there.
Mhm.
And perhaps things are too expensive. What's your vision for making this more available for more people?
Yeah. So look, the reason why Christine Burke gets the best outcomes in this area is one is experience. So she's had a lot of experience. But secondly, it's really about the organization of the information, right? So she, when you take on a patient and you don't know you see that the cognitive decline is happening, you're not sure why, you typically have to run some tests to understand. You've probably heard people say, Alzheimer's is type 3 diabetes, right? And for some people it is, but obviously not for everyone. For some people, you've worked in a coal mine for 20 years and you've been sucking up aluminium, like that can cause it too. And obviously my dad is an example on this end too. So there's all these different like potential causes. And obviously like thyroid is one that you're very familiar with. So then the goal has to be, how do you make it easy for doctors to know which one of those things is causing it and then practice appropriately? And this is maybe, a little bit getting into the weeds, but like, imagine you're the doctor and now you have 20 PDFs in front of you of all the lab tests that you've done and you're trying to work out what's what. That is an intellectually taxing business. And there's a lot of doctors who feel the urge to go into functional medicine and learn this because they see it work in their friends or family. But when they actually get into the job of doing it, it's actually very like intellectually taxing and difficult
Tedious.
to do it. It's tedious.
Yeah.
And so essentially what I saw when I got back from South Africa, I went to Seacrest, and she had this sort of janky spreadsheet system that she had built internally. And ultimately, what that system did was make it easy for her to see the patterns in the lab data and have it all in one place. And I just said, like, we've got to make a better version of this. We've got to make something that makes it easy for any doctor to input the labs and very clearly understand how is the patient participating in their health, and can we optimize that? Can we get them to do more with relate to, all of the sort of fundamental pillars, how they move, how they eat, how they rest, whether they're in a mental space to really want to get after this and do that, how they take care of their environment. So that is part of it. And then the other part of it is, could the doctor at a glance see, okay, this person, it's metabolic inflammation. This person, it's mold, or this person, it's a combination of those things. And Dr. Burke had built a version of that already. And so we got together and I said, look, I think I've got a way that we could make something that would be a lot easier for other doctors to use. So what I'm excited about is now we have a nationwide network of doctors that are using the software. And ultimately, what we're about to see and what we're starting to see already is that those doctors are like learning from each other in real time. And so we're through the data aggregation across all the clinics, they're learning exactly like what protocols to do in what order for what type of patients to get the biggest increase in cognitive decline, increase in cognition as quickly as possible. And we're in uncharted waters because none of the drugs that are on the market make it go, bring the cognition back. They can slow the journey, and even some like new drugs that are coming out, at best, they can slow the journey towards cognitive decline. The outcomes that we're seeing in these clinics is a reversal. And that reversal happens because the function comes back, and the function comes back in the places where the function has been lost. And the only way to do that is to kind of test and see what's going on. So the vision is that this year we're getting all of the like functional medicine doctors that are interested in doing this using the software. And then we hope that next year we'll be able to get your average neurologist, your average geriatrician, your average Medicare Advantage, doctor, and your average, sort of even senior living facility to be able to give people access to the software so that every person over the age of 55 can see where their risks are and play an active role in preventing it. Because the truth is that it starts 30 years before we have the symptoms.
Wow.
So the function is being lost 30 years ahead. And when you're 85, you have Alzheimer's. But if you had seen it and witnessed it at 55 and knew what was happening, that was the moment where you could have taken action. So the vision is an integrated network of clinics that are all using the same software. The software is learning from itself. And that ultimately it gets good enough that most people can avoid it through knowing what their risks are and taking action early.
That's incredible. And I imagine that you're taking the algorithms and working through artificial intelligence to really improve them so that you can just really dial into what's going on with a specific person.
Yeah.
And that will really reduce costs for people utilizing it. And that'll reduce the time the physicians, clinicians have to spend with this. And it'll also improve the accuracy, right?
All of those three. The biggest thing is making it easier for one clinic to add new doctors, because up until now, functional medicine education has been very long and slow and hard. So hopefully this is easier. But yeah, cost, access, all of that. And ultimately, like the data, the AI needs to be trained on the data of reversal. Right? So much of AI, you actually don't know what it's trained on. You don't know where it came from. And even if you trained an AI on all of the data about cognitive decline, what it wouldn't know is how to reverse it because it's never happened. Right? So in these clinics, some of the clinics are doing it with cognitive decline. Some of it are doing it with like very tricky brain health and mental health considerations that have the same etiology, right? Have the same root causes driving it. But in someone it shows up as mental illness, and someone it shows up as cognitive decline. And I'm very excited to see, already the patterns that are being discovered, and it's going to get better as we go along. But yeah, I'm excited to see what the future holds. And I feel like I can see, it's not like it's there yet, but I can kind of see where it could go. And that gets me really excited because I think there's real hope.
I love that. For anybody that might be listening, perhaps they're dealing with some cognitive decline or one of their family members is dealing with cognitive decline. So we talked about mold, various infections. I know in the nursing homes, I was always trained as a pharmacist consulting, like if somebody has rapid cognitive decline, urinary tract infections, like make sure you look into that. And I feel like not a lot of places are actually doing that. They should be. What are some other considerations from a perhaps chronic disease lifestyle component of things that you've uncovered in the process of creating this that might be contributing to cognitive decline?
Yeah, so there's sort of six main categories that we see that the data kind of falls into, and so the doctor would get a score there. So metabolic inflammation is the first one, so that's the like type 3 diabetes version. So that's one sort of fairly obvious one. There's one which is like nutrients and mitochondria. So like if the mitochondria are getting the nutrients that they need, then the function can go down and end up with brain function reduction. There's hormonal and trophic factors that would include all the thyroid stuff that you know so well, and we see elements on that side. There's chemical toxins, so range of chemical toxins in the environment that shouldn't be in the environment. And there's this biome and biotoxins, which is you would see like the chronic infections. You see, see the mold in my dad. And then there's cardiovascular. And Dr. Burke, the reason why she's so good and the sort of the reason why she gets the great outcome, she was trained as a vascular specialist. And ultimately, the new science is showing that the blood-brain barrier, which is really the sort of the main barrier that you have for keeping the bad stuff out and keeping the brain integrity, is vascular tissue. And so understanding how to create a healthy vascular system is really a key ability to create great brain health. So, that's the areas that we score the patients in. And so the doctor can see what out of those different areas is causing it, and then, have different protocols to bring that back into health.
It's fascinating. I know a lot of times people think that, okay, well, this is just like a natural process of aging and
Mm.
maybe vasculature changes as you age and all of these things sort of just happen as you age.
Mm.
What's your thought on this?
I think that is obviously the trend, right? We all die, and senescence and the way that the body breaks down over time is real. But I mean, just to give you an obvious example, like when I came down to see my dad, he came down. The other person who came down was his twin brother, right? Same
Same genes.
genetics, right? Has lived in London, has had a different life, but at that moment, my dad's brother came down and flew down by himself, booked his own rental car, booked his own hotel, and was zipping around Cape Town like old times, and walking around and being in a different state of health. And so right there, you see the gap, and that gap is a function of choices for the last 40 years. And, even my dad has an older sister who's like 92. And I saw her last year, and she jumps along and jumps on the bus, and she's extremely health conscious. And she's been, following my work in functional medicine, but she was always into that forever. So in that, you see the examples of it doesn't happen at the same rate. And every choice that you make over your life is either contributing to senescence or otherwise. So I think that's kind of an empowering moment. And ultimately, the choices that the moment where this is going to kick in is in your 80s, all right, or maybe in your 70s. Like, to what degree are you able to fully participate in the world? And that is a combination of lots of choices between, the first half of your life.
Yeah. Yeah, it's fascinating. I feel like I visit Poland quite a bit and I see some of the changes in our community here in the US. You kind of assume that everybody is going to be overweight as they get older and they have diabetes. And I'm not saying there's not a lot of that in Poland, but the amount of people who are still able bodied in their 80s and 90s in Poland,
Mm.
they're riding bikes around town, they're walking to the grocery store, they're eating much cleaner food. Of course, it's not perfect. And even without like the access to medicine, it's like they still have better health outcomes. And when you can bring the lifestyle medicine and all of the functional medicine together, and share that with the world, like what a completely different world we would have.
Yeah. Well, look, ideally, I mean, I'm a health economist. That's my
Yeah.
training. So I've been in the business of trying to think about how to create a healthcare system that keeps people healthy. And, where we're playing right now in this conversation is sort of at the end, right? Where obviously you've got cognitive decline, and how do we reverse that? But clearly, what you're describing there is that way further up in the food chain at like the cultural layer,
Yeah.
something different is happening in the Polish culture than the American culture that is keeping most people healthy without the need of a functional medicine doctor into their ninth decade. And I've been fascinated over my career to look at that kind of stuff, which is more like public health culture
Yeah.
levels. And so there's all the stuff about the blue zones, and I've really focused. My book was called The Community Cure because I really saw that community was the delivery of these either healthy behaviors or unhealthy behaviors, and that community could be a sort of a scaled solution to solve some of these problems in a really resource efficient manner. So I've been up and down the spectrum, across the economics of it. This project is very much in like, let's transform the actual care that's done,
Yeah.
because ultimately the cost trajectory of someone who goes through Alzheimer's is fairly catastrophic. And if you multiply that by the number of people, it's a real catastrophe, and many other chronic diseases too. But from the example you just gave, you know that there is a way that when culture and community reinforces healthy behaviors, that you don't have nearly as much of this, early stage chronic illness that we are blighted with. Now, the cool thing about America is because we've been in tension with this problem for longer, the innovation in the kind of work that you and I have done for the last 10 years, and I've had a chance to, through the Functional Forum, interview 1,000 doctors, put out 1,000 podcasts, like really understand that the level of medical innovation is much higher here than anywhere else for many reasons. And so my hope is that the lessons that are learned here in America can go out to the rest of the world before they experience the same problems that we have, as the percentage of food that is processed goes up, and the stress goes up, and all the other things that have caused these dramatic increases in chronic disease in America and Americanized countries like England.
Yeah. Yeah. I know you've been a big part of the Maha movement and building community. Can you share more about what that experience has been like and what all of us can do to maybe make America and the whole world a little bit healthier?
Yeah, well, look, I mean, I resonate with the message because when I first got into this world, I was interested in a very different type of brain, which was kids' brains. And the first job that I took in 2006, 7, 8, as I was working with doctors that were reversing pediatric brain issues. So ADD, ADHD, autism, all of the things that affect kids' brains. And so I've been passionate about that topic for a long time. And, my kids are healthy, and I'm so grateful for the opportunity to have learned from so many people to, you know, keep my children away from the poisons that are ubiquitous in society. So I'm grateful for that. I feel like, obviously we're at a cultural moment where um, the whole country agrees that we need to take care of our kids in a new way.
Yeah.
And, it's funny that in the 20 years that I've lived here, if you look at the sort of functional medicine movement, if I was at the beginning, there were some doctors in, New York and LA and in the sort of hippie towns around America. So Austin and
Boulder.
Boulder and Ashland, Oregon and Asheville, North Carolina, right? All of these places around there where there was that. So it was like a hippie movement. But yet now this real push politically comes from the other side. And so I see that there's a unity now, that everyone wants healthy kids, and they're aware. Like, I think most people are becoming aware now that we have the most chronic disease in the world. What I hope to bring to this movement is some sense of community, because ultimately so many of the ideas that I see being pushed around are really ending up with people buying things. And I really feel like what's missing is actually this community and cultural layer that keeps people healthy. And I'm really interested in what that is. I'm interested in changing the way that medicine is done. And I think that a root cause approach to medicine can make a big impact. But I'm hopeful that some of the other efforts and things that I'm involved in can, one, create more social cohesion on a county by county basis. Like I've seen examples and I've done podcasts over the last 10 years of places, actually typically not in America, in England and other areas, where groups of people, typically led by a doctor in the community, have done something really transformational for the level of loneliness or the social cohesion in the town. So I'm very interested on that kind of stuff, because the net benefit is for everyone. The people benefit, the medical system benefit, everything benefits from that. And then I'm also just trying to think about how can we make it easier for regular people to engage with the services that already exist in their county, in their town. And I think a lot of the kind of practices and organizations and support structures already exist. It's just that most people don't even know that it exists or what it could do for them. And so I think if we really want to make change in the next 2 years, 4 years, or otherwise, we have to focus locally. And that's what I'm really excited about, trying to see if we can get some momentum for a county by county transformation.
Let us know how we can be a part of that.
For sure. Yeah, we have, we have some, in the past, one of the things that I did was this show called the Functional Forum, which I still do. But for 10 years, we were really trying to introduce doctors to each other and create sort of supportive communities where doctors who were bucking the trend and practitioners to come together and learn from each other. And, ultimately what we're sort of testing now is, can we use the cohesion that was created, through that, to be able to take that information out to the masses in a more sort of scalable way, so that people know that it exists, and that those people who now are aware of the problem can be aware that there are solutions, and they're probably in their town already.
I love that. I know we had talked about re-envisioning functional medicine training, because I know for me, when I've done my trainings, it's like intense. You have to leave your house for a while and just sit in these lectures, and it's hours and hours and hours, and sometimes none of it is like as relevant to what you're doing right there in the moment. And with this new AI fueled platform that you're developing, like that can really shortcut your ability to get all of the information that you need as a practitioner to help somebody feel better, like really, really fast.
Yeah, that's the hope. I mean, if you look at it historically, the easiest thing to do is to put on a conference. It's not that hard. You have some speakers, you invite people, and people sit and learn. But I really feel this is sort of like the Henry Ford faster horse moment, right? If you asked doctors what they want that, but a little bit better. But ultimately what they actually want, I think, and what we're already seeing, is they want something that gives them support for the actual patient in front of them at the moment that they're sitting with the patient. Yes. Because even if you learn through case studies, that case study is slightly different, has different either psychosocial factors, environmental factors, ability to participate in their own healthcare factors, never mind slightly different lab values. So what you actually want is, you want the software, or you want something to be able to tell you, what to do with this person in front of you, or guide you in that decision support. And I think that once doctors experience that, they realize that the educational journey that we've all been through in the last 20 years, through mainly lectures, is actually a very inefficient way to learn how to do this. And I'm hopeful that we'll see that this will allow every doctor in the world to potentially understand a root cause diagnosis and to be able to use it in an efficient way, because the technology is doing the heavy lifting.
Yeah. I remember I had learned about the mitochondria and the organic acids, and had taken a lecture and a whole seminar about this, but I didn't need to use it until it just came up one day for somebody, and I had to like go back and search through all of the notes and like rewatch all the webinars when it came relevant for somebody. And I wish there was just like an opportunity to like, okay, this is a person, and I'm going to share what I know about them, and this is going to give me some up to speed, up to date, like best practices that I can get them better. And I know conventional medicine has been trying to do things like that for a while with like EMRs, but of course it's like very much limited because they're like, are you on a statin?
Yeah.
It's like, is everybody on a statin? Is everybody on this? Which, we could talk about as well, but this is going to be groundbreaking, and this is going to change so many people's lives.
Yeah, look, I hope so. I mean, to give the conventional medicine example, I think it is actually easier to do it in that way because the algorithm is fairly straightforward because
Yeah.
it's based on symptoms. When you start to build a system around function, you need to think in a complex way. And ultimately, the human body is complex, AI is complex, conventional medicine is complicated, but it's not the same thing, right? There's complex systems. There's the way in which one interacts with each other. So I think it has the potential, and yeah, we'll see. I'll be doing this until you next hear from me.
So you've been at this for over 10 years, and you've talked to thousands of functional medicine practitioners. What have you learned in that time?
Oh man, it's been a crash course. It's actually before I started the Functional Forum, I was just in the industry and I sat in a lot of conferences too. So it's definitely been a crash course. What's been amazing is how many things that are kind of normal now were extremely niche and weird, back when I first heard about them. And so many things in society have become extremely popular, and you now see advertised on TV. Probiotic is an example. I remember sitting with my partner Gabe watching TV or watching the US Open, and an advert came on for a probiotic, and it was like 70% of your immune system's in your gut, and it was like on national TV, and we're like, what's happening here? Like this is something that you would hear in a functional medicine conference a few months or a few years before. So a lot of things have become popular like that. I was actually just looking back at the stats, and your talk from the 2017 Evolution of Psychiatry event that we did in Boulder is the number one talk of all time on the connection between thyroid and mental health. And, it's very interesting now because I see that brain health, mental health is so interconnected. It's like how your brain is functioning, but it seems to just hit a chord that many people were experiencing, and many women particularly experiencing mental health challenges. And at no point was there ever a consideration that, well, this might have something to do with your thyroid. But then you watch that video and you'd be like, well, here's the mechanism, here's the way that it could happen. And so I can only put it down to the fact that like that really resonated with a group of people who have been looking for answers and had never had this kind of consideration.
And it's interesting because we posted that in 2017, and it just went viral like last year or the year before. And I feel like the conversations people are having are shifting. Many more people are talking about mental health. And I don't always agree with what they say,
Hmm.
because some of them are like, okay, you have mental health issues. This is a forever thing. And I don't necessarily agree with that, but I'm really glad that the awareness is there and that it's okay to talk about it. I know I grew up in Eastern Europe, so it was like, we don't have mental health issues here, right? Like
No.
if you're depressed, it's probably because you didn't clean your house, or you have too much time on your hands, and so on and so forth. And I feel like the culture has really shifted to people talking about these things, and it's being uh, part of it is scary because it's normalized, right?
Hmm.
And another part of it, I think, can be a big opportunity because so many people are talking about it that we can finally let people know that there are answers.
And clearly, the answers aren't the drugs because there's 337 million prescriptions of benzodiazepines last year. And is the mental health of those people going up? Like, are they reporting better mental health a year later or not? It's a slow decline, or it's actually kind of a rapid decline. So, once you've seen someone have a complete remission of their mental health issues from a root cause approach, then you realize the Overton window of possibilities is much wider than we thought. It's just that we're not really in a position to access that. And so I guess part of the dream when I started the Functional Forum is I would go to these conferences and I would look around and be like, hey, is anyone filming this? Like, this is genius. What's happening here? This could be the solution to so many issues. And if only every doctor knew this, we could really transform that. And I would see that no one was. And that was the beginning of the Functional Forum concept was let's just capture the wisdom of the community and put it in a place where everyone can watch it. And so when I saw it going ballistic and I saw 500,000 people watching this talk, I was like, that is the dream achieved. So thank you for bringing it in the way that you brought it. Thank you, E-Town in Boulder, for capturing everything in 5 cameras, and the audience for being there. And then thank you to the internet for democratizing access to this information. And I'm sure this podcast is going to go a long way to doing the same thing and accelerating that even further and helping a lot of people.
Yeah. Thank you so much for all the work that you've been doing for functional medicine, putting it on the map, and for really transforming our healthcare system. I really appreciate you and the work that you've been doing.
Thank you.
Such a pleasure having you. Where can people connect with you and find out more about your work?
So jamesmaskell.com is where I have a list of all the different projects that I'm involved in. Coming up, actually, in a couple of weeks, we have the Reversing Alzheimer's Summit, where people can go and really learn about all of the different ways in which brain function goes away and how it can come back. And we've got some of the leading educators and innovators in this space educating in that way. And at jamesmaskell.com, you can find out about the books that I've written and the different projects that I'm involved in. So that's probably the best place.
Great. Thank you for sharing. We'll add these to the show notes. And everybody listening at home, thank you so much for tuning today. Hopefully, this conversation has been helpful on your healing journey.